Hi, my name is Gail Valeriot, and I'm a consultant to community benefit organizations in Guelph, Ontario, Canada. I'm also a graduate of the Creating the Future Immersion Program for Consultants. I want to talk a little bit today about the power of a community-oriented vision for our organization. Here's two examples that I think can illustrate a community-oriented versus an organizationally oriented vision. The first one sounds like this: we will provide excellence in everything we do. That comes from a hospital. The second one: everyone is engaged in building a healthy, vital, resilient community. That comes from a volunteer center. You see the difference between those two vision statements? One is very much oriented towards what we do, how we operate, what sorts of things we are engaged in as the workers or as the organization. The second one is very much about how people in the community are going to change and how the community itself will change. In the second example, we're talking about vitality and resilience and health, good health, that will be the result of all the work that we do. In terms of my own experience, one of my best professional and personal experiences of strong vision statement came when I was doing work in a neighborhood organization called Onward Willow Better Beginnings, Better Futures. This is a very busy neighborhood organization, lots going on every day, very easy for the program to get swamped by all the demands that were happening in the community, and very easy for the focus of the program to be shifted by all those demands. So this organization had created a vision statement that was like its North Star. And that vision was that every child would reach their 20s in good health, having had a great education, and feeling secure and positive about the kinds of contributions they would like to make to their community in the future. When a tobacco company offered to make a substantial donation, it caused the community to have some pretty significant and substantial conversations about the kinds of impact that receiving those funds would make on the community itself, make on the children, make on the neighborhood. And finally, after a lot of debate, came to the decision that it would make it hard to model for children healthy behaviors and healthy attitudes, because there were a significant number of smokers in the area, in the neighborhood, parents in programs, etc. And the decision was made that not taking this money allowed us to have the kind of conversation about what it meant to provide a healthy experience for kids. What we saw as a result was some of the staff members decided to quit smoking, and over time very few staff actually are smokers there. That parents quit, that kids didn't start to smoke. This was very powerful. People didn't smoke in the doorways anymore because they realized it made them conscious of the fact that everything they did had an impact on young children. That's pretty powerful stuff, coming from one little vision statement that said every child should reach their 20s healthier and more secure than they had been when they were born. And I'll ask you just in closing to ponder the vision statement in your organization, and if it doesn't look or sound like it's about the community, don't panic. Recognize that most organizations, it's already implied in what you do, and so you're going to have to do a little bit of archaeological excavation to uncover it, but be assured, rest assured, it is there, and it's just going to take a little bit of time to find it. I wish you luck, and thanks very much.